get up and go, and she had spirit and energy. Because she died of it, it makes her look like some kind of victim. No, not at all. She did all she could to help herself.
When I was going out with Linda, she did cartwheels all the time. One of the songs Linda wrote after she became ill was, "I can't do cartwheels anymore."
Lynn loved canoeing, sailing, swimming, music and acting. Then it was like everything changed overnight. Her legs were paralysed. She couldn't move her head from side to side. She was tube fed all the time.
I trained as a nurse and a midwife. I've never ever seen anybody suffer the way Sophia suffered for all those years.
Linda's lying in a darkened room in so much pain I couldn't even touch her.
She looked so grey and so still that her brother said Naomi looked dead.
This is as important as any other significant major illness, whether it's cancer, heart disease, AIDS.
It is a complex, chronic, multi-system illness.
Some doctors don't believe in it, and if you don't believe in it and your patient has it, then there's a problem.
They didn't believe that I was physically ill. My suffering was belittled and undermined at every turn, really. I was made to feel like I'd done something terribly wrong.
She was thrown out of a medical practice. They just said, in our opinion, you're depressed. One doctor just said, you're afraid of standing.
It didn't have to make sense because they were the doctors and nobody was going to question them.
This girl suffered abuse at the hands of professionals. She went into hospital moderate and came out 6 months later severe, needing tube feeding.
It is not a psychiatric illness. It's not an illness which is associated with mental and behavioural disorders.
The psychiatrists that were involved with Lynn nearly destroyed her.
I was denied any say in anything that happened to me.
Her human rights were literally thrown away.
These are true horror stories where the families have really been abused by the professionals and by the court process. None of them have ever had any restitution, apology or damages.
We have a national catastrophe on our hands, and we need to face that fact.
I just wish the media would allow proper coverage of exactly what ME can do to you and what it did to Lynn, how ill she was, how broken her body was. And it was ME that did that. It was ME that destroyed her.
Naomi was a very bright child, full of life, loved everything she did. She was very creative and talented. She enjoyed playing the piano and the flute. She very much enjoyed playing with her brother and sister. They were all very close.
We used to make up plays and dances, and we were always playing together. Loving it in the summer when you'd come home from school and go outside and play and ride your bike and then be called in for tea and just be eating it quickly so you could go out and play again.
She was full of energy. She was just full of life.
1, 2, 3, stop, stop, stop!
Last month was the 20th anniversary of the day that I first became ill, and it was quite a shock to think that I've been ill for that long. The vast majority of that time has been spent within these four walls, in this room.
Naomi became ill in January 1990. She had a cold flu type virus, but the difference was the symptoms didn't improve. In fact, they got steadily worse.
ME is really a clinical syndrome. In other words, it's a recognised pattern of symptoms. Many patients can have over 20 of these symptoms, and they fall into a clear pattern where the cardinal symptom is that the tiredness and all the other symptoms can be made worse by physical or mental exertion.
Naomi was taken into hospital at the end of March. She could still take a few steps, but with great difficulty. But we were quite relieved she was going into hospital, because we thought that she was going to receive the care and attention that she needed and would be given some help. Until this stage, we had been a fairly healthy family. We had had little contact with doctors, and we believed that a hospital was a place that was caring, kind, and would help you get better. Within a very short time, we were met with complete disbelief and hostility. If ever I left her bedside, immediately some member of staff would come along and start questioning her as to what was really wrong. Why did she not want to get better? Desperately trying to find a reason to pin her condition on.
I think the basic problem from which all the other problems flow is the degree of disbelief on the part of the medical profession in the reality of ME as a physical illness. Everything else flows from that. Because the tests, the standard tests for this condition are usually negative, doctors are already prone to disbelieve in it, and in general there's been a rejection of ME by organic medicine for the last 30 years. The vacuum has been filled by psychiatrists who like to make it part of their territory, and this tension between the two parts of medicine continues today, and I could say that things are probably getting worse.
They didn't believe that I was physically ill. I was made to feel like a criminal, really, like I'd done something terribly wrong, that I was wasting their time. And it was so striking, the difference in the way that I was treated and the other children on the ward. The nurses would kind of come work along the ward, and the other people in their beds, they'd be greeted with smiles and kindness, and then they'd get to me and it was like the mask would slip, and there was none of that for me.
Although she could barely walk, she was not allowed to have a wheelchair or any assistance to get from her bed to the toilet. When she had to go to other parts of the hospital for tests, she was made to walk, or rather she was dragged there because she did not have the ability to walk. She was literally dragged along the corridor because they were telling her that she could walk. Her legs became so weak that within a very short time she could no longer stand or support her own weight. She had a permanent agonising headache where she would be groaning most of the time because it was so painful. And at her worst, she was completely paralysed.
I couldn't move any part of my body. I couldn't open my eyes or speak. I felt just so shockingly ill, in so much pain.
She didn't communicate. We didn't know if she could even understand what we said to her.
It's absolutely terrifying to find yourself in in that situation where your body is completely dead, really, except it's not because it's in such terrible pain.
Her breathing was so shallow that I can remember one week when I was afraid to leave her side because I really thought that every breath was going to be her last one.
The condition itself covers a wide spectrum of severity, but even the mildest cases deserve diagnosis and recognition, because if they are given the wrong advice or don't handle themselves correctly, they can become worse. At the more severe end of the spectrum, there's a minority of patients who are truly in a pitiable state, some of them in hospital, some of them at home, and a lot of this end of the spectrum is really one of the most powerful proofs to me of what a real condition this is and how it cannot be explained away by psychiatric reasons.
When Lynn was diagnosed in the beginning, it was by a paediatric consultant, and he put her on a regime of exercise. She had to do a certain amount of exercise, a certain amount of schoolwork, a certain amount of socialising, no matter how she felt. She tried to do that, and she was getting worse. But we believed that the doctor knew best, so we said to her she had to do it. And it took us a while to realise that this exercise regime that she was on was actually making her worse. And she just continued to deteriorate very rapidly. Lynn became so ill that she wasn't able to swallow anything, and it was imperative that she had help of some sort. She went to a clinic where there was an ME specialist, and we thought, wonderful, she's going to get some real help now. And he told us, after she'd been in a little while, that he'd never seen anybody so ill with ME, and he'd never seen anybody have the fits and the spasms that she had. He then washed his hands of her and handed her over to a psychiatrist. He said, "I'm sorry, I can't help you, and he can help you." And that was all. That was the only explanation we got. On one occasion, we walked in, and the psychiatrist was sitting beside Lynn with a needle in her arm, giving her a drug, which, when she would answer, she would tell the truth of what had happened to her. We said to him, "You haven't asked our permission to do that," and he said he didn't need it. And we said, "Well, what has she told you?" And he said, "Nothing." And we said, "That's because there is nothing, she's ill." He wouldn't have it that it was a physical illness. She was labelled as having hysteria and lots of problems because of that. Any input that we had from psychiatrists was very, very destructive. Instead of helping, it nearly killed Lynn.
I think there's a real problem with current medical education, both undergraduate and postgraduate. The textbooks don't have this condition right. One of the leading paediatric textbooks relegates ME to the section in child psychiatry and calls it one of the commonest somatization disorders of childhood, and that has influenced generations of newly qualified doctors, and in general it's not taught on in medical schools and is left as a sort of stigmatized disease which doesn't really exist, and this is what exposes patients to the disbelief that it's still so widespread and possibly getting worse.
Getting it right in terms of the treatment that you involve patients in is critical. And if you get it wrong, if you basically put a person with ME on the wrong treatment regimen, you can do damage to that person. So we need to be so careful that we diagnose the person appropriately and get them the appropriate medical treatment, as opposed to giving them something that actually might make their symptoms worse.
It just got worse and worse. She was ill for 17 years. She was totally bedridden. Her legs were paralysed. She couldn't swallow anything. She was tube fed all the time. And she had terrible spasms and pain and sickness all the time. She couldn't read or write, and she couldn't speak, so communication was very, very difficult.
It is an inflammatory disease of the brain and the spinal cord associated with muscle pain, so there's a lot of muscle pain. In the early days, it was described as atypical polio. We now know that certain people with ME can suffer paralysis, so it's polio-like. It does have a paralysis associated with it. It does have inflammation of the brain and the spinal cord associated with it, which you get with polio. The other neurological illness has some affinity with is MS. And so both of these are major diseases.
Every system in her body was affected. She had liver dysfunction, angina, and kidney problems. Adrenal insufficiency became total adrenal failure. Her pituitary gland, the master gland, the body wasn't working at all. So there were lots of different things going wrong in her body in different places. And at a later stage, a scan showed that she'd actually lost 50% of her bone density. After she died, we had a post-mortem done by an ME specialist, which revealed that she had ganglionitis, so the dorsal root ganglia in her spine were infected. It's proof that ME is a physical illness. It is a neurological illness. The proof is there to be found, and was found in them.
The situation is grave. There are individuals who have the most significant medical problems, and they are being treated poorly. We have a healthcare system that is not attending to the needs that they have. Many individuals have given up. Many individuals have basically felt that their healthcare system, their governments have abandoned them. These are individuals who are stigmatized, alienated. They've had the trauma of an illness and then the trauma of the healthcare system, and often family members as well as co-workers who don't get it. The reason they don't get it is because there's so much stigma against this illness. We have to change this.
My parents were told that if I wasn't made to do things, that I would never get better. And their constant fear was that I was about to die, and they were told, well, that probably would happen if I wasn't forced to do things. And so I just lived in this constant fear of what was going to be forced upon me next.
It was thought that this illness was in her mind, and so if she was given AIDS, it would just reinforce the fact to her that she was actually really ill. I would carry her downstairs for a while, and that's how it's continued over the years. On the whole, Naomi has met with disbelief and hostility. She has come across some helpful professionals, but even those tended to feel that the amount she recovered was dependent on the amount of effort she put into it.
It's just as much effort to sit and get up as it is to get to that chair. Whatever you can do.
Really, everybody she has met has put it to her that if she tried hard, she would get better. And all I can say is that if it was just to do with determination and effort, Naomi would have been running around within a couple of days.
Oh, did it? You never know you have to do it, so do it.
There is a kind of doctor who does believe in ME, but then goes on to believe too strongly in the efficacy of current treatments, particularly graded exercise. So they can have a moderate case of ME under them, they can subject them to graded exercise, which makes the patient worse, and then they either disbelieve in the basic diagnosis and send them to psychiatrists, or they increase the forcefulness of the graded exercise, or they abandon them, or they subject them to care proceedings, or in some way blame them for not responding to their treatment, a bit like First World War generals who blamed the men for cowardice when the generals' plans failed.
From the time Naomi was completely paralysed, she has made incredible progress. The strength has returned to her body, but not sufficiently for her to be able to walk more than a few steps. Basically, everything that she does during the day, she requires assistance with.
Independence for me would mean going to the bathroom on my own, getting out of bed whenever I want to without someone needing to help me, stepping outside of the door and breathing in the fresh air. That's my idea of independence, and I don't have that. I strive towards it. I gain a lot of pleasure from looking out of the window, particularly looking at the hills. There have been times as well when it's been unbearably sad to look at them, because it's been such a reminder of the world out there that I just can't be part of. So desperately wishing that I could be out there enjoying and feeling free, and enormous sense of loss of life passing you by. It's like a bereavement really, but the person that's died is yourself and the hopes and dreams that you had.
Naomi spent 20 years in the same sort of four walls at home, but she hasn't let that get the better of her. I mean, there have been days where like she has struggled obviously, but I mean she doesn't let it get her down. She does still have an enthusiasm for things that she does, and she really does put her all into things.
It would be so easy to just sort of shut herself away and give up on things, but she's still good fun, and when she can, she joins in with sort of family life. So it still plays a big part in our lives.
I think it's hard for people to appreciate just how ill Naomi is. When she meets other people, it's during one of her better slots in the day, and she probably looks quite healthy and she can talk and hold a conversation. What other people don't realise is that is probably taking up her energy for the day, and straight away she has to return to bed to rest, and resting means complete rest, shutting out all stimuli. And this is the only way she will survive the day. Too many times she's been told that there's nothing wrong with her and that she's making it up. And as she has said to me so many times, if she was making it up, she would have made up a much better illness to have than this.
There is a consensus in the scientific field that individuals have incredible functional limitations. Many studies point that out. But in addition, we see studies from the immune system where there seems to be irregularities, a Th1, Th2 shift. We see irregularities also in the neuroendocrine system where cortisol levels seem to be abnormal. And that's, again, an indication that there's something biologically wrong. We see indications in cardiac functioning that there's something wrong, particularly low blood volume. We also see indications within the brain with functional MRIs, PET scans, and a number of different instruments. We see irregularities in study after study after study. So we know there's something happening, and that's the challenge, to put all these different pieces together.
Well, I first met Linda when I went to a place where children with profound disabilities live. She was an aftercare worker. We used to go camping and we used to walk on many, many beaches. We loved beaches. That's why it breaks my heart she can't come to this beach. When Linda became ill with ME all those 16 years ago, it was almost like overnight. She couldn't walk, we couldn't go swimming anymore, and over the last 16 years our life has become tinier and tinier and tinier. It's been such a struggle, especially in the early days when doctors just said that Linda was depressed, and I had no idea what was going on with Linda. To come to terms with that loss in our life, and to come to terms with the fact that we were very much on our own. One doctor, when Linda couldn't stand, just said, "You're afraid of standing." She was thrown out of a medical practice in the early days because they just said, in our opinion, you're depressed. After 4 years, we saw Dr. Betty Dowsett, and she diagnosed Linda as having very severe ME.
Every day of my life is a struggle physically. And it can be emotionally difficult to cope with just the level of physical torment I'm in. If I had cancer, if I had heart failure, if I had a stroke, people would have some understanding. But most people don't understand and don't accept I'm really ill.
It's important to recognise there's a minority of extremely severe cases, of which I've seen a large number, and the vision one has of these is of people lying in darkened rooms, in continual pain all over their bodies, lying on ripple beds, needing to be tube fed, needing painkillers, all sorts of extra nursing care, and this can continue for years. The paradox is they're the ones actually being treated the worst, who are most at risk of being abandoned by specialists, left to simple GP care and ignored by the system and by the media. They're even at risk of having their benefits cut. And this small minority of patients are being neglected by official medicine.
We've got a fantastic GP here. Trouble is, there's nobody he can refer Linda to. He did refer her to a neurologist. It was the most humiliating experience. Poor Linda couldn't barely stand. I mean, it was amazing she got there in the first place, but he dismissed her after 15 minutes and said she just needed reassurance. I go back with Linda after that, and I'm living with her in this agony and this agony and this agony. I can barely touch her. I don't know what to do to help her. But the neurologist said she just needed reassurance. What Linda really needed was intensive brain scans and investigations. That's what she needed, not just reassurance.
This is an illness that has limitations that are as severe as any of the most serious illnesses. And yet, individuals who have this illness basically are not believed. They have a very significant illness and yet have a medical establishment that doesn't really understand the significance of it. So the fact that you got these two clashing points of view makes it an extremely important thing for scientists such as myself to get involved and to figure out why. What's the reason for that? And my interest is that to try to find out why there's so much stigma, why there's so much disbelief, why you have people who are being considered as malingerers when they actually have a very significant debilitating illness. That's not a psychological illness. This is a medical illness.
It's been such a struggle to understand the politics of ME and to do something about it. And I've tried to do something about it through going to Parliament and representing people with severe ME in Parliament at the Gibson Inquiry. But the way I've really managed to do something for Linda is that I met with the head of the Primary Care Trust and I showed a video of Linda and I fought for Linda. And we've put a formal complaint in. And it's been really hard doing this. It's really hard to make a formal complaint, having to keep writing and keep demanding that something is done. We have made a breakthrough and a biomedical specialist in ME has been to see Linda. Let me emphasise, it's taken us 16 years to start to get Linda's needs met, and we have a long way to go yet in terms of that. Our life hasn't stopped because of ME, but it's certainly gone down roads that I never would have thought we'd have gone down back in those early days.
Believe me, you wouldn't choose to lie here day upon day, unable to move. You wouldn't choose to live this life when there's so much out there that's enjoyable and interesting and challenging and wonderful.
I think loss is the single greatest factor in severe ME. Loss on every conceivable level.
I am in absolute agony. I need to go to the toilet. I've been lying here for hours, but I cannot bear to be touched, even to be held.
In 1969, the World Health Organization included myalgic encephalomyelitis under the heading of neurology. It recognised the illness, it recognised the work that had been done on the illness, and there it is sitting in the neurology chapter at G93.3 as a neurological illness. So there we have a clear understanding of what this means. It means inflammation of the brain and the spinal cord with muscle pain. That's what it means. What comes after that is this persistent attempt starting in the 70s and 80s to reclassify this illness as a psychological, psychiatric illness, using, and that required different terminology. And the terminology that was introduced against the wishes of the people in the States, and it was done in the States in the first place, was a 1988 conference where the term chronic fatigue syndrome was adopted. The consequence of this is that by just either dropping the chronic or dropping the syndrome, you can move the whole understanding of the disease and the whole base of the classification of the disease from neurology to mental and behavioural disorders. And chronic fatigue syndrome is now the reason why we are struggling with the big debate in science and medicine, and where patients have been absolutely sidelined.
Chronic fatigue syndrome is a very trivializing name. Chronic fatigue syndrome is really like calling someone who has emphysema or bronchitis chronic cough syndrome. It just is not the symptom that really signifies the significance of those illnesses. ME is an illness that's extremely devastating and really has incredible functional limitations to patients. The fact that fatigue is so common in the population undermines its significance.
In childhood ME, I've seen a lot of cases where initial belief turns to disbelief, especially when tests come back normal, and then there's a variety of reactions. Sometimes the paediatrician simply rejects the patient and sends them back to their GP. Sometimes they give them a one-way ticket to psychiatry, and in general these patients are more fortunate than the minority of cases who are extremely unfortunate, where the professionals turn against the family and come up with really nasty explanations for the illness, such as Munchausen syndrome by proxy, that the mother is making the child ill to fulfill her own needs. Once they set the child protection machinery into motion, it is extremely upsetting for the family, and I've been involved in over 25 cases of actual care proceedings where children have been threatened with removal from their families, sometimes have actually been removed and placed in foster care, and then of course failed to get better. And this is really child abuse by professionals. I've been involved in the care of a young lady who was actually diagnosed officially with ME and went into one of these specialised ME treatment centres in hospital and was subjected to quite aggressive graded exercise treatment and was made much, much worse over 6 months. This was under a threat of a court order that the parents had to cooperate, and she was made much worse and is now at home very slowly recovering.
About 7 years ago, our 8-year-old daughter, B, started to become ill. Having got nowhere with our GP, we eventually insisted on her being referred to a children's hospital. A diagnosis of probable ME/CFS was made, but it was suggested that the underlying issues were psychological. So, to show willing, we accepted a referral to a child psychiatrist and took B for several sessions. But when B was told that she was not really tired and that she only thought she was, we informed the psychiatrist that we didn't believe further sessions would be helpful. The psychiatrist then called a meeting involving social services, and a child in need plan was proposed, clearly stating that if we did not comply, they would initiate child protection proceedings. Social services were now dictating what treatment B should be given, with no real medical support or input. They specified graded exercise despite being warned of the dangers, and we were required to take her for physiotherapy sessions. As a result, B deteriorated rapidly, eventually becoming wheelchair-bound. Under threat of court action, we were then forced to take B to a well-known children's hospital, where she was seen by a nurse consultant specialising in ME, and a diagnosis of CFS-ME was again confirmed. The diagnosis additionally concluded that B was depressed and that she should be hospitalised, offering admission onto their secure psychiatric ward as one option. Social services immediately called a child protection conference, and B was placed on the at-risk register on the grounds of neglect, and seemingly to emphasise the point, we were reminded by the police protection officer that we were not under arrest just yet. It was quickly made clear to us that unless B was hospitalised, court action would be started in order to have her removed. We were being forced to have our child admitted into hospital, even though we knew that this would probably cause her condition to deteriorate. We quickly searched and found what we thought would be a safer option, with a CFS-ME unit run by a consultant who appeared to view ME as an organic illness. How wrong we were. It was a disaster for B. She arrived wheelchair-bound, but she still had the ability to take care of her basic needs, to sit upright and read and write. But with their activity programme, she soon deteriorated to the point where she could no longer wash, dress or feed herself, and she was in constant pain when sitting in a wheelchair. She suffered steady weight loss until tube feeding became necessary. But in spite of this, we were told the programme of activities would continue and would even be increased. When B failed to tolerate the feed and frequently vomited, it became clear that their intention was simply to force feed our child in the naive expectation that she would then build up enough energy to increase her levels of activity. We were accused of imposing our belief that the treatment wouldn't work, and that B was willing herself to be ill. B's mother was banned from entering the ward between certain hours, and when neither of us were there, B was treated particularly harshly. Other parents would see her left unattended in a wheelchair, in constant pain, unable to sit upright, and with her head hanging down over the side, crying in distress. This continued for 5 months, and we were threatened that if B didn't start to make progress, she would be transferred to a psychiatric unit or could be placed in foster care. We were desperately in need of help, and turned to Dr. Spate and the Young ME Sufferers Trust. The Chief Medical Officer and the Secretary of State were asked to intervene, and within days we were informed that B was to be discharged and transferred to another hospital. A few months later, in 2007, Bea was allowed home, although she still needed tube feeding until she could be weaned back onto solid food. Interference from social services continued, but Bea was now under the care of a knowledgeable paediatric consultant, and they finally agreed to remove her name from the at-risk register. Bea is now 15. She is bedridden and partially paralysed, having been unable to move her feet or legs for well over 3 years. She needs to be in a horizontal position all the time, is unable to feed or wash herself, and is dependent on carers for everything. Fortunately, she can now cope with normal food, and her weight has stabilised at around 38 kilos, under 6 stone. She enjoys having books read to her, but communication is by whispering, as she finds speaking too tiring. Mostly she prefers to just nod or shake her head.
One of the problems around the whole issue of ME is the way in which the illness has been defined.
All science is based on having the same types of individuals so that we can make statements about their biology and statements about the different ways they react to treatments. So it's critically important to figure out who has this illness. The Oxford criteria and the Fukuda criteria are frequently used in Great Britain and other countries. The key problem is these are very large types of categories, and they could bring in to the category of ME people who don't have this illness. ME is often very similar to some of the symptoms of major depressive disorder, one of the most popular, prevalent psychiatric illnesses in this country and in my country, the United States. So it's critical to differentiate major depressive disorder from ME/CFS. And if you don't do that, you're going to start mixing some of those people with major depressive disorder into this category that we think of as ME.
For me, the important description of ME is that it is a complex, chronic, multi-system illness. And that's reflected in the very best criteria for diagnosing and understanding the illness, the Canadian criteria.
They are more specific. It's not a question of having some symptoms and not having other symptoms. You have to have things like post-exertional malaise. You have to have some of these neurological symptoms. You have to have the sleep difficulties. So in that sense, it's going to identify people who have the classic symptoms.
The Canadian criteria are clinical consensus drawn up by clinicians from North America, from Canada and the United States, and from Europe. So this represents a profound understanding of the illness from clinicians who are engaging with it on a daily basis. There's thousands and thousands and thousands of hours of patient care and patient monitoring and patient testing that's reflected in these criteria. And the fact they're not being adopted is of great concern to me and to people with ME. The Canadian criteria are for clinicians, by clinicians, and clinicians should need to use them to examine their patients.
We want to make sure we're studying people with ME and not major depressive disorder. And why that's so important is if you give an aerobic exercise or graded exercise or having activity as one of the primary things that you're pushing people to do more and more, people with major depressive disorder actually feel better. People with ME feel worse. This is an incredibly important differentiation to treatment. And yet, it's possible to put these two illnesses together because they share some symptoms. And that would be a major disservice because these two illnesses are different.
Sophia was very outgoing, lively, funny, artist, loved travelling, lots of friends, music, your typical girl, but with an edge, you know. She'd had meningitis before, she'd had malaria twice, she'd had the usual run of illnesses, childhood illnesses and the usual stuff. She did yoga, she ate well, she took care of herself. When my mum told me Sophia had ME, I didn't know much about it, but I thought it was a bit of a lightweight illness, and I wasn't worried. It took me a long time to realise just how ill Sophia was. A long time.
Not only was she in the darkness, but she also had pads over her eyes. She also had earplugs in her ears. She couldn't bear sound, not even the sound of a voice. She couldn't have visitors. She couldn't bear to be touched. All of these things, if they happened, they would make her more ill. She could no longer go to the doctors. The doctor had to come to see her. There would be huge, many months when her daytime would be night, and the doctor would want to see her, and she couldn't have it because the doctor didn't work at nights. The doctor told me one day how lucky she was, because apparently she'd asked a number of psychiatrists to get involved in Sophia's case, and they all had refused. But now she had got a psychiatrist who was willing to be involved. The doctor got a social worker involved from the mental health team. The social worker came to see Sophia and wrote a report to say that, yes, Sophia was very ill, but she wasn't mentally ill.
In spite of this assurance, the psychiatrist insisted on seeing my mum up at the mental hospital about Sophia, and the implication given was if my mum didn't attend this session, Sophia would suffer. So my mum went.
He told me there and then that Sophia needs to get better in 6 months. And he said, if she doesn't get better in 6 months, he said, I'll section her in a mental hospital. Well, I had, as a nurse, obviously I'd dealt with people before, doctors before, I'd seen them. I'd never heard a doctor speak like this. And I said, well, you're going to section her. And can you tell me how much better Sophia is going to get because of you sectioning her? He said, it's none of your business. That's for the courts to decide. I think it was in May 2003, the doctor, the psychiatrist and the social worker arrived at the front door of Sophia's flat. I was asleep at the time because I had to sleep during the day, etc. But I told the carer not to let them in, so they wouldn't let them in. Then I was frightened. I was really frightened, because now I knew what the psychiatrist said was correct. He also said at the time that if I didn't let them in, he would get the police to smash the door down. And I had spoken about this with Sophia, and I had asked her what she wanted me to do. I would have done what she wanted. Nobody believed me. Nobody believed Sophia. So I made a video of her. Can you see any differences in yourself, or say from last July till now?
I can talk more, I can move more, I'm eating much less food, I can have visitors, I'm thinking very clearly, I'm feeling optimistic. If I am forced to go into mental hospital, there is a chance that because I am an ME patient and not a mental health patient,
yes,
they will then give me the wrong treatment.
Yes.
And my illness, the chronic fatigue, will become worse. I do not want to be an example of what a mental hospital can do to an ME patient.
I took her to a particular solicitor who then came to visit Sophia. At length she interviewed her, and she told me afterwards Sophia was competent, so I thanked her and we were safe. Time went by, the weeks went by. They said they'd come back next week when they tried to section her the first time, but they didn't. And then 2 weeks went by, 4, 6, 8 weeks went by. We were safe now. They weren't going to come along. And then one Friday, late Friday afternoon, I heard the banging at the door. The police, the psychiatrist, the social worker, everyone was there. Sophia was asleep. It was her night time. So they phoned, they knocked at the door, they rang the bell. I never answered. It did this for some time, and then they smashed the door down. They all came in. And bearing in mind, Sophia had to be in complete darkness and everything, the noise of them coming in. And without a by your leave, they went into her room. It was the middle of her night time. They put on a light. She hadn't seen a light for maybe 2 years. They put on the light. I went to go in. They wouldn't allow me to go in. So the three of them were there with Sophia, who was supremely ill. And Sophia was so with it in many ways, all the time. So she taped all that was happening. Bear in mind, I didn't know what they were doing to her inside. I just didn't.
You're sectioning me under the Mental Health Act, and so that means that you believe I'm in danger, a threat to myself, or I'm a threat to society. What could you explain to me?
Yes, those are two categories you mentioned. The other category is a threat to yourself or a threat to...
I just want to say that I am making progress. When she first came to see me, I couldn't even speak. Can you see how much I'm talking, how much more energy I have within me?
Yeah, that is much better this year, but I'm disappointed because last time I came in January it was much more lighter.
If I do too much, if I move too much, if I talk too much, if I have too much light in my eyes or anything, my ME symptoms become worse.
Yes.
In your report, you said that you believed I was that I was in the right mind to make a decision. Please, could you? Is there any way I had to be monitored in an ME clinic?
Well, there was an opportunity to do that, wasn't there? You've had two opportunities, and you decided not to go ahead with those opportunities.
Yeah, but if I knew that, but the only other option was a mental health.
So you knew it was coming?
Well, no, I didn't know. If I knew that the only other option was to be sectioned under the Mental Health Act, then I would have gone to the ME clinic. My solicitor, when I spoke to her, I said that I was offered a place in the ME clinic. I turned it down. It wasn't. I explained to you, doctor, and I have on tape that I explained to you that it was because I asked them also about the treatment. I didn't feel that what they were offering me was going to help so much, also because of the journey. I said to her, I didn't want to go to the ME clinic, and these are the reasons why. And I said to her, but gosh, if they're going to say I'm mentally ill because I won't go to the ME clinic, then, I'll go. The conditions that I'm going to be kept in mental hospital are going to make the ME symptoms so severe, so severe. I'm just asking again, I've got ME, I'm not mentally ill. I've got ME, I have all the symptoms of ME. My ME is nothing to do with the relationship with my mum. I have a very healthy relationship with my mum.
Eventually, they opened the door and the ambulance people came.
I don't know, doctor, please tell me exactly what you're going to do to make me feel better.
Can you please, doctor?
I think you're at least answerable to me.
Yes, I think, and Sophia, I think we are going to remove you to a different environment to see whether it would make any difference.
If she gets worse, what happens then?
I don't have to. I don't think.
No, you don't have to answer.
If I don't respond, you can get me. Why don't we just why don't you just call the ME clinic first?
No. Huh? I asked the doctor, she wouldn't allow it. Because apparently now you're mentally ill. You no longer have ME all of a sudden. And yet now the doctor doesn't have to give a diagnosis.
They're just going to... Doctor, are you there?
John.
She was put in Sophia was put in a locked ward. It was a locked room within a locked ward of the mental hospital. I went to see her then every day after that, The solicitor put in for a tribunal. The psychiatrist was adamant he wasn't going to let this go, so he was going to keep Sophia in the hospital. The tribunal was held 13 days later. It lasted all day. Sophia was released. She wasn't mad, she was just desperately ill. That was in July 2003. And that was the beginning of it was the beginning of the end. She couldn't recover from that. All the things that were there before, but she'd been getting better from, these now came back and were there permanently. I just did the best I could, because that's all there was to do. There was no help out there. There was nothing. And she got weaker and weaker. In the last few days, she couldn't move at all. She couldn't move and she couldn't eat. And she couldn't drink anything. I would stand outside listening to her breathing. And that day her breathing got shallower and slower. And at 1 o'clock I didn't hear her breathing anymore. And I went into the room and I felt she was dead. But still I couldn't put on the light because Sophia couldn't bear the light. And I went over to her and she was dead.
After the post-mortem and inquest, there was proof of Sophia's physical illness, and my mum went with this proof to the General Medical Council to make a complaint about the way my sister was treated. And the GMC rejected my mum's complaint, and this decision was made by psychiatrists. So you have psychiatrists evaluating the behaviour of other psychiatrists who are treating somebody with a physical condition, not a mental illness. It's absurd. Her physical disease was being treated as a mental illness, and that's why she died.
The deaths that are coming from ME are really frightening, because the suggestion that no one dies from ME is just simply untrue. The present attempt to treat ME as a mental and behavioural disorder have completely failed, and it's been a failure that's been supported by the refusal of the MRC to fund any research at all into biological cause of the illness. One of the worst statements I've ever seen is that the government funds to support policy. Well, this is policy. It's wrong policy. It's bad policy. It's destructive policy. It's deceptive policy. But we fund to support it because we are the government. And government actually has committed itself ideologically, in an almost Orwellian sense, to ensuring this illness is really to be regarded as mental and behavioural. And that is where the fault lies.
My personal impression is that currently things are actually getting worse rather than getting better, and I think people are interpreting the NICE guidelines to feel compelled to involve psychiatrists and a multidisciplinary approach, and to have too much faith in graded exercise and cognitive behavioural therapy. There is an additional problem in that with the orthodoxy of the NICE guidelines coming in, a lot of doctors who are at the forefront of supporting and treating patients with ME, both adults and children, seem to be at professional risk of having complaints made about them to the GMC. Their patients are being deprived of their services, and other doctors are operating in a climate of fear. There seems to be a sort of new Stalinism coming into British medicine.
The whole deception that's been practiced to maintain this stance is, I think, unacceptable now. We must really get to grips with the illness and listen to the people who've published thousands of papers showing it is a physical illness with a physical basis that can be addressed.
I think what's needed now is the medical profession to take this condition on board, to accept responsibility for it as a physical illness, to do more research looking for biological causes for it, to downgrade the emphasis on psychiatry, and to improve medical education along these lines. If this condition hadn't been hijacked by psychiatry for 30 to 40 years, we would have found the cause for it by now. Things would be in a far better state.